Hi, my name is Abby. I'm a midwife in Cavan General Hospital. I want to show you different movements and positions to support you in early labour. If your waters have broken or you have been advised by a healthcare professional to come into hospital when labour starts, these movements and positions can be utilised in the hospital setting. We advise that you remain at home for as long as you are comfortable to do so, or until your contractions are a regular 5 minutes apart and lasting 50 to 60 seconds. You count your contractions from the beginning of one contraction to the beginning of your next contraction. Please be mindful of your distance to the hospital, and you can phone the maternity unit at any time, where the midwife will advise you. Moving around and changing positions in labour can help relieve pain, shorten the length of time of your labour, and distract you from your contractions. Movement in labour makes sense. Your body is usually upright, which means gravity is helping to move your baby down your birth canal. Walking in labour will help to open up your pelvis. When you are standing, rocking or swaying your hips from side to side or in circles with feet and knees apart may help to relieve pain or tension in your muscles, and it may also help to speed up labour. Music and positive affirmations will also help. If your labour has slowed down, walking up and down the stairs can help speed it up. Sidestepping or lunges will open your pelvis at varying angles as you move up or down the stairs. This encourages your baby to move down into an optimum position for birth. When using a birthing ball, you can complete many different movements, including the figure of 8, hip circles rotating back and forth, and the pelvic tilt. Gentle neck stretches and shoulder rolls will help to relieve muscle tension. The use of a TENS machine can also be beneficial at this stage. If you feel you need to rest, lie on your left side and place some pillows in between your legs. If you feel unwell, stop, take a break, and talk with a midwife. You can also try and rest in a warm, not too hot bath, or sit backwards on a chair or toilet. Many women find the all fours position comfortable as it takes some of your baby's weight off your lower back and helps to relieve back pain in labour. It will also give your baby more room in your pelvis. Kneeling can be done on the ground using a yoga mat or pillow on the bed. The pelvic tilts can also be achieved in the all fours position. This is also a good opportunity for your partner to provide some physical support by gently rubbing your back or shoulders. Use your birthing partner to lean on for support in a standing or squatting position. They can emotionally support you in this way too. Supportive words and affirmations during your labour will stimulate the love hormone oxytocin. This will encourage your contractions and release endorphins, unnatural painkillers.
Hello, my name is Sinead Thompson and I'm a community midwife at the National Maternity Hospital. I designed and created Labour Hopscotch in 2015 in response to an increase in the epidural rates and also in medical interventions during labour and birth. The principle of Labour Hopscotch is to encourage optimal fetal positioning. This means having your baby's head in the optimum position, lined up so it can descend into the pelvis in the optimum position for labour. When this happens, it triggers the spontaneous onset of labour. When women go into spontaneous labour, it's less likely that they'll need induction, and that means that there'll hopefully be less intervention in their births. The Labour Hopscotch framework aims to support and promote natural and active labour. It is encouraged for all women, regardless of the care pathway that they choose for their birth, but encourages more natural methods of pain relief where possible, for as long as possible in labour. Using the idea of the game hopscotch we all played years ago, each of the steps can be undertaken to remain active during labour. The process can start at home, beginning at the bottom of the hopscotch board when you're more active and mobile. The bottom square of the Labour Hopscotch is called the mobilised square, and it aims at promoting optimal fetal position. There are 4 activities associated with this step, and it's important that these 4 positions are practiced throughout the antenatal period in preparation for your labour. Your midwife will explain the positions to you during your pregnancy. Our research findings, which we published in 2019 in our research study, showed that women who practiced labour hopscotch had reduced epidural rates, reduced the caesarean section rates, increased spontaneous onset of labour and vaginal deliveries, and most of all, there was an increase in birth satisfaction rates. Having a positive birthing experience makes a smoother transition to parenthood.
Hi, I'm Aisling and I'm going to talk to you about the importance of being active in birth. When you arrive to our birthing suite, we encourage and support you to have an active birth. By an active birth, we mean not being confined to the bed. You are free to move around and give birth in a position of your choice. Gravity will encourage the descent of your baby's head through the birth canal. Being active during your birth can reduce the length of the first and second stage of labour. It can reduce the risk of needing a caesarean section, an epidural, or intervention. Movement during your birth is encouraged for optimal fetal positioning, where your baby is in an optimal position for birth. For your baby to be in an optimal fetal position for birth, we encourage you during your pregnancy to be up, forward and open, UFO. Imagine your tummy is like a hammock. We want your baby to be lying in the hammock, not lying against your back. Using a birthing ball during pregnancy puts you in the UFO position and is really comfortable to sit onto. Some movements to use on the birthing ball to encourage optimal fetal position are pelvic tilts. This movement helps tilt your pelvis, thereby encouraging baby to move into an optimal fetal position and can help ease back pain in the early stages of labour. Figure of 8 or hip circles. This exercise encourages your baby to descend into the pelvis. It can also aid in relieving lower back pain. It is important to circle both clockwise and anti-clockwise in this movement. Forward leaning aids in tilting the pelvis, thereby allowing more room for baby to rotate into an optimal fetal position. Hip sways, gentle movement that opens up the pelvis to aid descent of your baby into the birth canal. It is safe to use the birthing ball for the duration of your pregnancy, unless you have been advised not to by your doctor or midwife. When you are in established labour and all your initial checks are complete, we encourage you to be as active as much as possible. You can move around your room, lean on the bed, sit on a ball, get into the all fours on the bed or on the mat. If you want to get out of your room, you can walk the corridor, use the stairs or use the bath. If you are getting continuous monitoring, talk to your midwife about the availability of the mobile CTG monitor. If you decide on an epidural as your method of pain relief, it is still important to stay as active as possible to encourage optimal fetal positioning until you have the epidural. Once the epidural is working effectively, we will ask you to move on your left side, right side, your back or the sitting position. Using a peanut ball in these positions helps the rotation and descent of the baby and can reduce the length of labour and the risk of a caesarean section. Whatever you choose for your birth, we will support you and help find you the optimal position for both you and your baby.
Hello, Nuala here, Parent Education Midwife. I am going to discuss both natural and pharmacological pain relief options for labour and birth. Water or hydrotherapy is a fantastic way to ease pain and cope with surges during birth. During your labour, having warm showers and baths can help you to relax and cope with pain. The support of a partner and one-to-one support from a midwife has been shown to reduce a woman's need for pain relief in labour and increase her chances of a natural birth. Comfort measures, mobilisation and birth aids such as beanbags, birthing balls, hot or cold compresses aid discomfort during birth. Use of labour hopscotch can help you cope during your labour and give you a higher chance of a natural birth. Hypnobirthing is a birth preparation course that teaches you to access your subconscious mind, to relax, trust your body, and alleviate the fear of childbirth. Techniques such as visualization and meditation can relieve pain. Relaxation is a skill which takes practice. Work on cognitive measures should be done throughout your third trimester. A TENS machine, or transcutaneous electrical nerve stimulation, is a non-pharmacological method for relieving pain. TENS machine targets nerve pathways to boost natural endorphins in the body to cope with pain. The earlier in labour the TENS machine is applied, the more effective it is. You should be familiar with your TENS machine prior to your birth. You can hire or buy a TENS machine from your local pharmacy or budget retail chain. Pharmacological methods. Paracetamol is safe in pregnancy and can be taken to ease pain, particularly in early labour. Ensure only to take the recommended amount. Pethidine is an opioid pain medication given via intramuscular injection. It works within 20 minutes and relief lasts up to 4 hours. It will not get rid of labour pain completely, but will help you cope better and allow you to rest. It is routinely given with an anti-nausea injection. Pethidine crosses the placental barrier, so cannot be used in the latter stages of labour. Entonox, also known as gas and air, is a mixture of oxygen and nitrous oxide gas. It is inhaled via a mouthpiece. Entonox won't get rid of the pain completely, but it is a good distraction and can help to regulate your breathing. Entonox is readily available in the labour ward. An epidural is a type of local anaesthetic given into the epidural space in the back. An epidural numbs the nerves that carry the pain impulses from the birth canal to the brain. Prior to getting an epidural, an IV cannula will be placed in your arm to administer fluids to regulate your blood pressure. An anaesthetist is the only person that can administer an epidural. You need to sit in a slouched position for approximately 20 minutes to get the epidural inserted. The anaesthetist will insert a needle into your back and pass a tube or catheter into your back that will continuously administer anaesthetic to you until after your baby is born. An epidural is the most effective form of pain relief for labour and birth. However, you will be restricted to the bed throughout your labour. Continuous fetal monitoring is recommended with an epidural. A urinary catheter will be inserted into your bladder, as with an epidural you lose the sensation to pass urine. An epidural is associated with a higher incidence of assisted birth. A spinal anaesthetic is a technique in which local anaesthetic is placed directly in the back. It numbs you from above your bump, and it is primarily used in maternity for elective cesarean sections. You can use any and all of these pain relief methods throughout your labour and birth. You do not need to know exactly what type of pain relief you would like for your birth. Your midwife will guide you on the day and answer any questions you have.